Medication-induced movement disorders and other adverse effects of medication. The conditions listed below are not mental disorders, but are nevertheless included because of their relevance to the management of medication for mental disorders and the differential diagnosis of mental disorders. Establishing a direct causal connection between the disorder and the medication suspected of causing it is by no means always clear or even possible, as these disorders may also at times manifest in the absence of the medication. Note, neuroleptic, also called antipsychotic, medications have a propensity to induce movement disorders as a side effect. These side effects are called extrapyramidal symptoms and may include acute dyskinesias and dystonic reactions, tardive dyskinesia, Parkinsonism, akinesia, akathisia, and neuroleptic malignant syndrome. Typical neuroleptic medications include first-generation antipsychotics such as chlorpromazine, haloperidol, and fluphenazine, and second-generation antipsychotics such as clozapine, risperidone, olanzapine, and quetiapine, and certain dopamine receptor blocking drugs such as chlorperazine, promethazine, trimethylbenzamide, thiopyrazine, and metoclopramide, and the antidepressant amoxicillin. Neuroleptic-induced Parkinsonism, characterized by Parkinsonian tremors, muscular rigidity, difficulty in or inability to move, akinesia, or slow movement, bradykinesia. These symptoms typically manifest after a few weeks of beginning a medication or altering its dosage. Neuroleptic malignant syndrome, characterized by excessive perspiration and generalized muscle rigidity that is unresponsive to treatment. The individual's mental state is in an altered state of consciousness ranging from stupor to coma, including delirium. Symptoms typically manifest within 3 days of exposure to dopamine antagonist agents. Medication-induced acute dystonia, characterized by atypical and long-lasting muscle contraction of the eyes, head, neck, limbs, or trunk. Symptoms typically manifest within a few days of beginning a medication or altering its dosage. Medication-induced akathisia, characterized by the individual's being in a restless, agitated state, essentially being unable to be still. These symptoms typically manifest after a few weeks of beginning a medication or altering its dosage. Tardive dyskinesia, characterized by involuntary slow movements or involuntary irregular jerking movements enduring for at least a few weeks. Of the lower face, jaw, tongue, extremities. Symptoms usually manifest after a few months of the administration of neuroleptic medication. If condition manifests subsequent to ceasing or altering the administration of neuroleptic medication, then it is termed neuroleptic withdrawal emergent dyskinesia. Tardive dystonia, characterized by involuntary muscle contractions that precipitate slow, repetitive movements or abnormal postures. These symptoms are tardive in that they manifest late in treatment, develop slowly, and may endure a prolonged interval after ceasing the administration of neuroleptic medication or reducing of its dosage. Tardive akathisia, characterized by agitated, restless, fidgety movements. These symptoms are tardive in that they manifest late in treatment, develop slowly, and may endure for a prolonged interval after ceasing the administration of neuroleptic medication or reducing its dosage. Medication-induced postural tremor, a fine tremor similar to tremors associated with anxiety, caffeine, or the use of other stimulants. Tremor appears when an individual tries to maintain a posture. Tremor manifests in association with the use of medication. Other medication-induced movement disorder. This classification is for medication-induced movement disorders not previously listed, when the condition appears to be associated with the use of non-neuroleptic medication. Antidepressant discontinuation syndrome. Manifest after the abrupt discontinuation or significant reduction in dosage of an antidepressant medication that was used for at least a month. Symptoms typically appear within 2 to 4 days of stopping or significantly reducing the dose. The use of medication. Symptoms are variable depending on the medication discontinued, but may include nausea, seeing flashes of light, and feeling electric shocks, as well as hypersensitivity to light and sound. Additional symptoms may include insomnia, dizziness, anxiety, and ringing of the ears. Symptoms are alleviated if the medication is reintroduced or a similar medication is started.